Well, we have been looking forward to spending the day with you, but really, at the same time, we are missing being able to be together with you in person, especially during these isolating times that we're living in. Like so many charities and organizations, we have been navigating new technologies to help us be connected with our members. For today, I'd like to ask you to join me in thanking our event IT and production sponsor, Finch Loom. They've been remarkable, helping us learn this landscape and put together a professional event. So thank you, Finch Loom. As you can appreciate, organizing an event like this involves a commitment from many people. With this said, I'd like to begin by saying thank you to the presenters and the academic program director for your leadership in this endeavor. Your leadership has been extraordinary. I would also like to say thank you to Spinal CSF League Canada for their partnership, and from both our organizations to the volunteers for their assistance in all of the administrative details. Through this experience, your dedication and support are helping to inform policy and give hope. So 2020 has brought so many challenges to people across our country and the globe. From wildfires to COVID-19, our resilience has been tested beyond the daily pain that our members already face. For the ILC as a charity, in its 10th year, we have been devastated by the loss of our members, Heather Rosinski, a dedicated volunteer since 2013, and our founding ambassador of Hope, Brooklyn Mills. This kind of loss cuts us open, but we know we have to carry on to honor the contributions that they have made. To those of you that are representative of the patient and caregiver population, we want you to know that we hear you, we see you, and we care. You are our raison d'etre. So as the ILC come together again in this 8th year of hosting an accredited conference, whether for EDS, mast cell activation, spontaneous spinal CSF leaks, and the in-common suffering from chronic pain, within healthcare, we all appreciate the many competing issues. However, it is the right to have access to care that we all agree upon as a major issue. Well, to our healthcare professionals here today, who are our leaders, we believe in you. We believe in your leadership, and we believe in your ability to help take us out of the state of inequities of health. As many of you know, the ILC's guiding principles are based on collegial cohesive collaborations. The partnership with Spinal CSF League Canada to this end has been an excellent experience. We have worked together to frame the conference to expand the understanding and resources of Ehlers-Danlos Syndromes and related conditions of heritable connective tissue disorders, as well as again on spontaneous intracranial hypotension caused by cerebrospinal fluid leaks. We are excited that Dr. Smeenk is available to be here with us again today to provide an update from his presentation at our 2017 conference. And for those of you here today that attended that conference, I trust that you will remember Denise Livingston's presentation, where she helped to raise awareness about the challenges of obtaining a diagnosis and treatments in both EDS and spinal CSF leaks. As in past, the educational focus of the conference is on the current best evidence information from leading Canadian and international specialists, with the ultimate goal to improve the quality of life in the patient population. While last year's in-person format provided great opportunities for networking between professional peers and individuals alike, We have no doubt that this year's remote web conferencing event will have the same, hopefully the same meaningful connections, albeit we realize in social media connections through peer support. Of importance, both our organizations want to be able to keep our dialogue ongoing with you. So if you have a question that is not answered today, or you wish to connect for any other reason, please don't hesitate to reach out. Dr. Mittal, who is the academic program director of this conference, will speak to you following Spinal CSF LEAK Canada's welcome. At that time, Dr. Mittal will go over the academic program. In your registration packages, you will have received the conference program, which details the schedule of the day. You will also have received detailed information on the process for asking questions. Be sure to locate the hand icon on your screen in case, should you wish to participate in that way. So during the noon hour break, we invite you to leave your screens on or sign back on early. There will be slides about research studies that you may be interested in, and as well there will be a special presentation from our sponsor Finch Loon. At this time, I would like to introduce you to my friend and colleague, Bahare Noorbakhsh, co-founder and director of Spinal CSF LEAK Canada. Thank you for being here today.